Coronavirus symptoms defined in mild, moderate, and severe symptoms. Mild, moderate, serious, extreme, or severe. These are some of the adjectives being used to describe the symptoms displayed by patients with COVID 19. Vice President Pence used them in his remarks to the nation. Some large percentage have mild flu symptoms. Some have serious flu symptoms. At this stage of the COVID 19 pandemic, there is not a standard definition of what symptoms are associated with these designations. It can take years for such guidelines to be issued for a newly identified disease, according to Dr. Sandro Gallia, an epidemiologist and dean of the Boston University School of Public Health. Nonetheless, there are some preliminary definitions that can be helpful in understanding the range of these symptoms. Mild symptoms. In 80% of known cases, COVID 19 causes mild to moderate illnesses, according to a report of a joint World Health Organization China mission of 25 infectious disease experts held in China late last month. At a press conference on March 9th, Maria Van Kerkhove, technical lead of WHO Health Emergencies Program, had this to say about the symptoms for a so-called mild case. This mild infection starts normally with a fever, although it may take a couple of days to get the fever. You will have some respiratory symptoms. You will have some aches and pains. You will have a dry cough. This is what the majority of individuals will have. A mild case of COVID 19 in and of itself is not dangerous, but in some cases, more commonly in older people and in people with underlying health issues, a mild case can progress to a moderate case that could require some supportive care such as fluids for dehydration, typically in an emergency room or urgent care center, especially if hospitals are overwhelmed by the most acute cases. Moderate symptoms. Symptoms of being moderately ill with COVID 19 include coughing, a fever of about 100.4 degrees, chills, and a feeling that you don't want to or can't get out of bed, said Adalha. Some patients also experience shortness of breath, although that can occur in various ways. Shortness of breath is a wide spectrum, and whether we consider treatment will be based on how short of breath they are, their age, and other health conditions, says Galea. It is shortness of breath after climbing a flight of stairs or when there is no activity, for example, when you're just sitting in a chair, asked Dr. Theresa Madeline, hospital epidemiologist at the Mount Fair Health System in New York City. In either case, there's cause for concern with a confirmed or suspected COVID 19 case. Shortness of breath with this virus is a symptom to always check with a healthcare provider. Period, says Dr. Kenneth E. Lone Q, a pulmonologist in the section of Critical Care Medicine and Department of Medicine at National Jewish Health in Denver. That's because shortness of breath can be caused by low oxygen levels in the blood. Your blood carries oxygen to organs and tissues, and low levels can lead to organ shutdown or even worst case scenario death. For patients with moderate symptoms, hospitalization is unlikely unless they are having difficulty drawing a breath or they are dehydrated. Signs of dehydration can also include increased thirst, a dry mouth, decreased urine output, yellow urine, dry skin, a headache, and dizziness. But there's another possible development within the mild to moderate classification. Some of the individuals will go on to develop a mild form of pneumonia, Van Kerkhove says. While pneumonia can often resolve on its own, especially in younger people, in older people and those with underlying health conditions, pneumonia can be a life-threatening or require hospitalization, especially if someone's immune system is weak. In these instances, without supplemental oxygen or if needed, a respirator to aid helping, a patient's organs can shut down and the patient can die, says Galea. People with pneumonia can also get secondary bacterial infections, which can be life-threatening and require treatment with intravenous antibiotics. Serious, severe, and extreme symptoms. According to the report of the WHO China Joint Mission, in about 1 in 5 patients, the infection gets quite worse. About 14% of cases can develop into severe diseases where patients may need supplemental oxygen. And 6% of cases become critical and may experience septic shock, a significant drop in blood pressure that can lead to stroke, heart or respiratory failure, failure of other lungs, and worst case scenario, death. Theresa Madeleine says that in some patients, symptoms can progress to severe in a few hours or over several days. A different problem can occur if disease progresses. The virus can enter lung cells and start replicating, killing those cells. The immune system may take action to fight the virus, creating inflammation, destroying lung tissue, and sometimes resulting in a more severe form of pneumonia. This immune system response can impair your ability to get oxygen into your blood. Without enough oxygen, inflammation can become more severe and result in organ failures. What should you tell your doctor about symptoms? Keep in mind that mild, moderate, and severe are the inelegant terms we have to use right now, says Dr. Shira Doran, hospital epidemiologist at Tufts Medical Center in Boston. Use symptoms rather than adjectives when you speak to a healthcare provider, and then they can determine whether you need to consider treatment.